The committee will come to order. Good afternoon and welcome to the final session of our public witness hearing for American Indians and Alaska Native programs. I also want to welcome all the distinguished tribal elders and leaders here today and to thank our witnesses for appearing before the committee and sharing your concerns on these important topics. I will call each panel of witnesses to the table, one panel at a time. Each witness will have 5 minutes to present testimony. Your full written testimony will be included in the record, so please don't feel pressured to cover everything in just 5 minutes. We will be using a timer to track the progress of each witness. When the light turns orange, the witness will have 1 minute remaining to conclude his or her remarks. When the light turns red, I'll have to ask the witness to stop to remain on schedule. We'll hear from every witness on each panel before members will be provided an opportunity to ask questions. Because we have a full afternoon ahead, I request that we try to keep things moving so that we can stay on schedule and respect each other's time. I also want to note that the committee rules prohibit the use of outside cameras and audio equipment during these hearings. The hearing can be viewed in its entirety on the committee's website, and an official hearing transcript will be available at gpo.gov. I'm now happy to yield to Ranking Member Pingree.
Thank you. I'm happy just to add my welcome to the chairs, and thank you all. I know it takes a lot of time to get to Washington, and it's a big trip for a lot of people coming from all over the country. So we really appreciate your time. We learn a lot from these hearings, and it really helps quite a bit in putting together the 2025 Appropriations Bill. So thank you very much for your presence, and I look forward to your testimony.
Thank you. Chairman Simpson, Ranking Member Pingree, members of the committee. My name is Michael Douglas. I'm a Haida tribal member enrolled with the Central Council of Tlingit Haida Indian Tribes of Alaska. I'm also the Senior Vice President and Chief Legal Officer for the Southeast Alaska Regional Health Consortium. I'll bring it a little closer. Thank you for the opportunity today to provide testimony regarding the FY 2025 appropriations proposal for the Indian Health Service. By way of background, Southeast Alaska Regional Health Consortium is a Alaska Native-run nonprofit tribal organization comprised of 15 federally recognized Alaska Native tribes. These tribes have authorized search to compact with the Indian Health Service on their behalf to administer a comprehensive healthcare delivery system for the Tlingit, Haida, Tsimshian, and other Native people of Southeast Alaska. Search was founded in 1975 and is one of the oldest and largest Native-run healthcare organizations in the country. Today, our service area covers 42,000 square miles of the Southeast Alaska Panhandle and is comprised of 27 community clinics, with most of the rural communities we serve requiring access via boat or plane. Search also operates 2 long-term care facilities and the Wrangell Medical Center in Wrangell, Alaska, and Mount Edgecombe Medical Center in Sitka, Alaska, both of which are critical access hospitals. The Mount Edgecombe Medical Center in Sitka is our primary hospital and is critical to our ability to provide quality care throughout the region. For that reason, among Search's top priorities has long been to address the aging condition of this facility so that it might be suitable to provide health care at a level required for a modern healthcare system. This facility was first constructed in World War II and through the 1950s served as a tuberculosis sanatorium. So today, at more than 80 years old, the current facility is not able to support the quality or quantity of health care that our patients require either now or in the future. And as Search has often testified to Congress and to this subcommittee, the Mount Edgecombe Medical Center has long been in dire need of replacement. Fortunately, in 2021, Search and the Indian Health Service entered into a joint venture construction program agreement to replace this facility. Under the JV program, tribes and tribal organizations may enter into joint venture projects with the IHS through which the tribal organization funds either the construction or the acquisition of a new facility, and in turn, the IHS, once the construction is complete, commits to fund the additional staffing and operations costs associated with the new facility. Working together with the IHS and through the joint venture program in Congress through critical land transfer legislation for this campus, Search is now financed, planned for, designed, and begun construction for this new facility, which is a 234,000 square foot hospital and medical facility we anticipate will be complete in 2025. The administration's FY 2025 budget includes $47.75 million for the staffing and operations cost package for this new facility. The staffing operations package is a critical near final step in what has been a multi-year effort that required deep coordination between search, the federal executive and legislative branches, tribal governments, and the state of Alaska, and the result will be a state-of-the-art healthcare facility for the people of our region. Search is very excited to complete this new hospital project because we will immediately improve patient care and demonstrate to our patients that Search remains committed to delivering the highest possible care to this region for generations to come. It will provide much-needed employment throughout the region and will help us address the perennial challenges of physician recruitment and retention, and the enhancement of a broad array of clinical and support services will also further our extension of high-quality care to our remote village-based clinic sites as well. Search urges the committee to support the administration's request for staffing and operating costs for the newly constructed healthcare facilities, including requested funding for Mount Edgecombe Medical Center. Search would also like to express our continued appreciation for providing advance appropriations for the Indian Health Service and urges the committee to do so again in FY 2025 and for every year until mandatory funding for the Indian Health Service can be secured. It is critical, however, that the advance appropriations funding levels account for the cost of medical inflation and population growth in tribal communities, because in the current environment, a flat funding or nominal increases could result in a decrease in access to care. Search appreciates the committee's hard work in upholding the United States' obligations to Alaska Natives and American Indians. With your steadfast support, tribal healthcare providers have been making major strides in improving access to high-quality healthcare in high-quality facilities. Supporting the IHS budget, including the joint venture staffing package, will continue this legacy. Thank you again for the opportunity to provide testimony on behalf of Search. I'm happy to answer any questions you might have.
Thank you, Michael.
Thank you.
Mary Jane?
Thank you. Good afternoon. I am Mary Jane Miles, Vice Chair of the Nez Perce Tribal Executive Committee, and I'm also an ordained minister in the Presbyterian Church, and I serve 2 Native American Presbyterian churches. The Nimipu, the Nez Perce, want to thank this committee to hear us out and to understand the needs of Indian country and our tribal governments and all the members that share our community. Like any government, the tribe does a variety of work and provides a lot of services, not only for our tribal membership, but for the citizens that share our homeland. The tribe has a health care clinic, a tribal police force, a social services department, and a comprehensive natural resource program, and one of the largest fisheries department of any tribe in the nation, working on the recovery of listed species in the Endangered Species Act. Each of these programs is necessary to preserve and protect the treaty rights of the Nimipu. Today I'm going to focus on public safety and law enforcement. In relation to the BIA Public Safety and Justice account, the tribe supports a $75.5 million increase to funding for law enforcement over what was enacted in the account in fiscal year 24. The Nez Perce Reservation spans 1,200 square miles, covering 5 counties, and has a mixture of tribal and non-tribal citizens. The reservation is rural in north-central Idaho, and it is home to a state that statutorily refuses to recognize tribal law enforcement as peace officers. This is a major barrier to finding suitable space to house offenders arrested by tribal officers. In some instances, local jails have refused to house our inmates because of their first obligation to state-recognized agencies. Sometimes our officers have been forced to transport inmates to other reservations up to 8 hours away. This has had major implications to staff, public safety, and officer morale in working to provide adequate services to the communities on our reservation. The tribe provides a full-service law and justice program and recently completed a construction of a detention facility. The tribe has a fully trained and staffed police force, a court, prosecutor, public defender, and other personnel. Currently, the tribe covers 80%, about $4 million of the cost of these services. The BIA only covers 20%, about $1 million. The jail facility is necessary to house tribal inmates, but comes with increased operational costs. And our dispatch services alone take up 35% of the BIA monies. If the tribe were to only pay staff using BIA contracted dollars, those funds would cover roughly 12 positions. Our needs assessment is that we need 29 police department employees. The shortfall in funding is especially felt considering the fentanyl crisis that we all are impacted by. The money to pay for these services comes from tribal taxes on goods and fuel and from gaming revenues, which could be used for governmental services. For the tribe to fulfill its law enforcement on the Nez Perce Reservation, an overall increase of funding is about $1.5 million, which is needed from the BIA for staffing and operational costs. I want to thank you for hearing me out, and I want to invite Chairman Simpson especially to our homeland on the Nez Perce Reservation, as well as all of you to come and visit the Nimibu. Thank you.
Mary Jane. I plan on being up there this summer.
Thank you.
Talk a little bit about salmon recovery and a few things.
Yes.
Willow.
Good afternoon. My name is Willow Hetrick Price. I'm the Executive Director of Chugach Regional Resources Commission. We abbreviate ourselves as CIRC. Kind of sounds a little bit like search, but it's not. We're an intertribal fish and wildlife commission responsible for over 31 million acres of Aluktik, Sukbiak, and Eyak homelands in the land and waters of Alaska's Chugach region. I'm going to be talking to you about two issues today. First, that our BIA Tribal Management Development Program, or TMDP, program funding be increased to parity with the increases in the program budget overall. And second, that you exercise fiscal oversight to ensure that BIA's management aligns with Congress's intentions. CIRC is a consortium of 7 Alaska Native villages in the Chugach: Eyak, Port Graham, Chiniga, Nanwalik, Tutitlik, Katuchek Native Tribe, and Valdez Native Tribe. We are the only entity that provides comprehensive natural resource management services throughout a land area larger than the size of West Virginia, and whose lands and waters would displace New York as the 30th largest state in the nation. Most of our communities are not accessed by road. The only way our tribal citizens and tribal members survive is through hunting, fishing, and gathering of subsistence resources. As the original managers of our land and water, our tribal people have unparalleled knowledge and strong cultural ties to the ecosystem, which informs our biocultural management and restoration within CIRC. We perform a myriad of services: habitat protection and enhancement, conservation, stock assessments of subsistence resources, climate adaptation planning, environmental capacity building in our communities, to name a few. We also monitor the ecosystem, provide hydroponics and game processing facilities for food security purposes, and operate the only tribal marine research and shellfish hatchery in the state of Alaska, where we've begun getting into the kelp mariculture industry, which I know you all have heard a lot about. For these activities from the BIA through TMDP, we receive $410,000 annually. This works out to be less than 1.5 cents per acre. Compare this in our region to the National Park Service's $4.6 million budget for the Kenai Fjords National Park, which is less than 2% of our territory. That's $7.64 an acre that they have to manage their land. And the Forest Service's $21 million budget For managing natural resources in the Chugach National Forest, which is about a third the size of our region, that's $3.89 an acre that they get to do their work. Over the past 10 years, Congress has more than doubled the budget for TMDP, and this is great because there's inflation, and every dollar that's provided to tribal organizations at a local level results in far more savings to the federal government in terms of staffing, project costs, travel, and duplication of experts. Unfortunately, in that same 10-year period, our budget was increased only once, which is equal to less than 1% per year. We request that you increase CERC's TMDP fund to $1.18 million to bring CERC's budget back in line with other programs in the TMDP account. Our results are worth the investment, I promise. In the last 5 years, we've increased our operating budget from $1 to $5 million per year. For every dollar of federal subsistence special project funds, we have returned $3.50 on investment by leveraging other public and private funds and resources. These efforts, in turn, inform and enrich federal and state agencies' data and management decisions for natural resources. But our lack of recurring base funding means that this isn't sustainable. We are severely limited by short project durations, the heavy burden of compiling grant applications and associated reports once funding, and the lack of certainty from year to year. So a stable, fair increase in our base funding in TMDP would allow us to increase the federal return on investment and build a sustainable natural resource management program in our region. Second, we also ask that you exercise oversight of the BIA, requiring reports to you when BIA fails to make payments to tribes. You guys put in a lot of difficult work to get funding and to keep the agencies going, but BIA does not get that funding to us with the same urgency. We begin work each fiscal year on October 1st, but do not receive that funding, even though the BIA does, until 6 to 9 months after beginning working. To this day, today, we have not received our funding for FY24 and no response from the BIA about when funding may come. So we are paying for the government's work out of our own pocket for months and in some cases years. So we ask you include report language requiring the BIA to pay tribes within 30 days and report to you on that performance. Thank you so much for having me.
Thank you, and thank all of you. I'm Dr. Donna Galbraith. I am the Senior Medical Director of Quality Assurance for South Central Foundation, or SCF. I am a tribal member of the Mentasta Traditional Council. SCF is an Alaska Native tribal health organization. SCF is one of the largest employers in the state of Alaska with over 2,700 employees. We serve 70,000 Alaska Native and American Indian people providing health care. Our service area is over 100,000 square miles, which is not very small. It's basically the size of Wyoming, for another reference. We have over 85 programs. We deliver health care. We deliver primary care and dental care and behavioral health and addiction programs, just to name a few. We also co-own and co-manage the Alaska Native Medical Center with Alaska Tribal Health Consortium. Advance appropriations is critical to the stability of the tribal health care system. SCF appreciates the Appropriations Committee providing advanced appropriations to the Indian Health Service 2025 budget. These appropriations should be permanent until mandatory funding is secure. In addition, there needs to be increased funding because of the cost of medical inflation and the growth of population. If this isn't done, eventually care will be affected and the health disparities will increase. Mandatory appropriations and exemptions from sequestration are also needed. Indian Health Service is the only federal health care program that is not exempt from sequestration. The possibility of cuts leads to uncertainty in budgeting, and you all know you can't run a business without knowing your budget, so it is a big issue. SCF appreciates the committee's attention to 105L leases. SCF supports that these costs remain part of appropriations. These costs and contract support costs should be mandatory. Twice the Supreme Court has ruled that Indian Health Service should pay for contract health supports. costs. Indian Health Service has actually deemed part of those costs as secretarial and refused to reimburse. These costs have been paid historically and are part of contract health support costs. SCF requests that the committee include language in the appropriations bill that requires Indian Health Service to compute 2025 contract support costs as done in 2021. The pandemic has highlighted the shortage of healthcare workers. It has also caused widespread burnout, and this is a national issue, and it's actually critical. You can't have health care if you don't have enough workers. So this is actually felt much more severely in tribal communities because it's hard to recruit and retain people in these communities. SCF has built systems internally to help with this, but additional support is needed from the federal government. There needs to be increased scholarships and increased bonuses for hiring and retention for anyone working within tribal organization. In Alaska, one of the key factors in recruiting and retention is the lack of professional housing. Indian Health Service should do a needs assessment of professional housing in Alaska and then seek funding. Behavioral health is a big issue. Some people have already mentioned that. Alaska Native and American Indian people are disproportionately represented in behavioral health issues. The drug overdose death rate in American Indian Alaska Native people increased by 39% from 2019 to 2020. That's 1 year. That's a huge increase. The suicide rate amongst Alaska Native people is 3 times the national average, and in some communities it's 6 times the national average. SCF has integrated behavioral health to try to address some of this needs, but there's only so much we can do. There's a dramatic need for increased funding for behavioral health needs. This funding should be appropriated and then distributed to all tribal health programs through formulas rather than through the grant process. Grant process cannot affect all of these things. The need is just too great. The intent of Build American and Buy American Act is appreciated, but there are financial restrictions. We know there are waivers, but those are complicated and they take a long time. So a lot of the times the construction season is missed. SCF encourages the committee and Congress to consider a narrow tribal exemption for this act. In terms of self-determination, SCF suggests that the committees for jurisdiction consider moving beyond Indian Health Service when it comes to contracting and compacting to allow indigenous people to chart their own health care path. Thank you for the opportunity to testify in front of you on behalf of South Central Foundation and the 70,000 people that we partner with on our journey to health and wellness. Thanks.
Thank you, Donna. What is your assessment of what's caused the increase in suicide rates and drug addiction and stuff that you mentioned?
It's a multitude of things. You see this nationally. It's not just American Indian, Alaska Native people. You see it everywhere.
But not to that extent.
Not to that extent. Yeah. But I think there's a lot of things that contribute to that. Social determinants of health have contributed to that, and just the lack of people feeling like they can't get out of whatever situation they're in. It just leads to hopelessness and helplessness.
And you mentioned the difficulty of finding healthcare workers and stuff in Alaska. And I mean, this is an issue we've talked about many times, but how do you get a doctor to go to a remote village in Alaska that he's got to fly to be there and stuff? That's got to be a real challenge.
Yes, it is a challenge. We don't expect doctors in every single community. I mean, that is not going to work. So we have a system where you have community health aides in the smaller areas, and then in some of the hubs you have physician assistants and nurse practitioners. In the larger areas, they have the doctor. So it creates this web of care throughout the state. But we just don't get enough doctors at all. And I'm also speaking on behalf of all tribes. It's not just Alaska, but all tribes have this issue too, and it's the same thing. It's rural sites. There's no housing. They go into a community that they really don't know the population. They don't know the culture. They don't understand things, and it seems very foreign. Some people thrive in that situation, but some people don't.
Some people retire to that situation.
That's right. You're absolutely right.
Do you do a lot of telemedicine?
Yes, we do. Yeah. And we increased that especially because of COVID. We went to a lot of telemedicine then. I mean, we always did it, but we increased that a lot because we wanted to ensure that people got the care they needed, even if they couldn't come in. And people were actually pretty receptive to that. The people we serve are empaneled to their provider because we want them to get to know their provider and their provider to get to know them and build that relationship. And because those relationships were built, we were able to actually do that type of care, by distance in a good way. People were receptive of it. But I will say that after 2.5 years, I'm stumbling because I want to say customer owners, because that's what we call patients as customer owners. After 2.5 years, our customer owners said, no, I want to see my provider. And so they started coming back in, and, we limited, times and people within our system. But it actually worked out well, and we did see a decrease in some of our statistics, but not by much, not compared to some other organizations.
Thank you. Ms. Pingree.
Well, thank you, everybody, for your testimony, and appreciate both the healthcare perspectives from Alaska and just the magnitude of the area you have to cover is enormous, and really appreciate many of your thoughts, and good luck with the new hospital. I'm glad to hear that's moving forward. That seems like a really significant move, and an 80-year-old facility, that's pretty darn old to have to deal with. And thank you for your, Vice Chairwoman, the things you brought up about law enforcement we've been talking a lot about today, and just the very idea that you might have to drive somebody 8 hours to get to a facility is really unthinkable. But the chair talked about that earlier, about the complicated web of who has jurisdiction, and then the disagreements with jurisdiction when the county doesn't always get along with the thinking of the law enforcement of the tribe. It shouldn't be such a complicated problem. So I hope we can work on that more, and very interested to hear about all the work you're doing with wildlife management. And it's interesting, I come from Maine, and we have a growing kelp industry, and I was just visiting one of our kelp processors the other day, and they were like, we got to pick up the pace. Alaska's going to take over. So, but there you go. But I mean, there's a huge future in aquaculture, and we both have states with huge fisheries. We're tiny compared to Alaska, but with the changing temperature, with a lot of factors going on in the ocean, it's really important that we're investing in aquaculture. So, I hope we can offer you more support in the kind of resource management that you're doing. So, thank you all very much. Thank you. I yield back.
Thank you, Mr. Chairman. Thank you all for being here. I'd like to point out the Woodbury Forest School on their government class trip. Thank you, gentlemen, for being here. We've been doing this for 150 years with the tribes, and haven't gotten it right yet. And this just continues to tell us that. And as we talk about the suicides and the opioid abuse rates, and with the lack of law enforcement on the reses, now the cartels are moving in and killing our young men and women and killing our future. So staggering statistics, and it's a tragedy and a travesty at the same time. And Mary Jane, I just want to tell you on a brighter note, I could hear you talk, I could listen to you talk all day long, and so you hold us in rapt attention. You have a beautiful voice, and it's I think you should be in movies. You're very good at it. But thank you all for being here, and we have to get these things right. So thank you, Mr. Chairman. Yep.
Let me just ask this before I go to Betty. Representative Elsie mentioned the fentanyl and stuff crisis. We've heard that on all the other reservations that are down in the lower 48. Same thing happening in Alaska?
Yes, it is, and it's going up just like every other place.
Is it?
Yes.
Because of its remoteness? And I mean, I'm wondering, how the hell does a cartel get out to some place that's so remote and stuff, But I guess they are geniuses that way.
Yes, they are, and it is slower. Trank, that probably everybody's heard about here, has just now reached Alaska. So it's a little slower getting there, all the stuff, but fentanyl has been there for a while, and we have seen a marked increase in deaths. It's slowed a little bit, but it's still increasing every year.
Yeah, I know that's a big issue with the Nez Perce and stuff. I've talked to the chairman quite a bit about it. So, Ms. McCullum.
Thank you. the conversation, it's a delicate one to even talk about, because whenever you talk about suicide, you want to offer resources immediately. So Congress has been working on a first call for help and other things. But in this room, back several years ago, we had some tribal youth, the future, young adults, talk about what was going on with suicide at the time at Pine Ridge. And we put some dollars into suicide prevention on that. So this morning, we kind of focused on education. People were talking about Johnson O'Malley, drug courts, early intervention for youth. I would just ask, being outside, with an adult, taking that deep breath, having someone pay attention to you or just walk silently next to you. In Alaska, with the remoteness and its suicide rates are going up for our youth all across the country. People are feeling hopelessness. Some of it was contributed to COVID. Some of it might not be contributed to COVID. What are some of the things that, especially with youth and suicide, that it's best to talk to them as they did to us? We closed, after the hearing was done, we sat in a room with the doors closed and just let them talk. But are there some things with mental health, especially for young adults, that you think we need to be aware of as we put this budget together?
I think mental health overall has not been funded. And I think that suicide is a very complex problem. And so there isn't one nice solution. I wish there was, I really do, because whenever a suicide occurs, it affects everybody. It's really horrendous. So it's going to take a multi-pronged approach to even come close to making a difference. I think it's really important that people learn to be proud of who they are and where they come from. And so, there's a lot of effort within tribal communities to build up the culture again and to, teach young people how to be culturally appropriate and what it means to be a part of that tribe. I think things like that help. I think support for families also help. Like I said, it's a multi-pronged approach. It's not going to be easy, but ignoring it doesn't mean it's going to go away. I think it's going to get worse before it gets better.
Mr. Edwards.
Thank you, Mr. Chair, and thank you to our guests. I really appreciate you taking time to be here to share your stories and talk about what's important. I know that you traveled a great distance to be here. This committee would not have the opportunity to hear from you had you not made the financial and the time commitment to be here. I want you to know that your testimony, your comments are meaningful. There are a lot of needs for our tribal nations in this country. I wish that we could go and meet every one of those instantly. I doubt that we're going to be able to do that, but you being here is extremely, extremely meaningful in us knowing what those needs are as we make our decisions to help prioritize those. So thank you.
Thank you. And I should tell you before I let you go, I really do appreciate the work that resource people do in both Alaska and what the Nez Perce do in Idaho and other tribes and stuff. Having studied Idaho salmon runs, which are endangered, and they will go extinct if something is not done. I will tell you, my firm belief is if it had not been for the Indian tribes, those fish would be extinct today. But the incredible work that they've done in keeping them alive until we can get a solution that gets them off the threatened and endangered list and gets them back to levels that, every tribe in the Pacific Northwest, now I'm off on my soapbox, every tribe in the Pacific Northwest, when they signed treaties, they retained their right to fish in their traditional places of fishing. Guess what? Those rights don't mean anything if there's no fish there. and especially if the reason there's no fish there is because of actions we've taken. So we have an obligation there, and you tell Chairman Wheeler when you see him that I'll be up there this summer, and we'll talk some more about this. But we've had many great conversations with over the years at the summits and stuff that we've been at. So thank you all. Thank you all for being here today. I appreciate it very much. Let me get on to the next. That's on the next page. Just those two? Okay. Quentin Swanson and Esther Lacaro. That's as close as it gets for me. Lucero? If I say it several times, one of them will be right. English was never my major in high school. Thank you for being here today. Quentin, you're first.
Thank you, Chairman Simpson, Ranking Member Pingree, and members of the subcommittee for this opportunity to share our priorities for fiscal year 2025. My name is Quentin Swanson. I am the chairman of the Shoalwater Bay Indian Tribe. We are located on the beautiful north shore of Opiate Bay in Washington State. Like many coastal tribes, we are stewards of the ocean. As tribal chairman and lifelong resident of Tokeland, I have learned firsthand that vibrant and successful communities are not possible without a healthy community and a healthy environment. I appreciate the subcommittee is responsible for these same priorities, and it is in that shared spirit of community that I speak to you today. Tribal communities are uniquely impacted by our changing environment due to a deep connection to our ancestral homelands. My tribe faces persistent erosion and sea level rise. Our current reservation is just barely above sea level, and a rise of just 2 more feet would put everything underwater. At any moment, a single tsunami would take out our entire community and what defines us as Shoalwater people. I urge this subcommittee to support significantly increased funding for Indian country, especially chronically underfunded tribal environmental resiliency programs. We are disheartened that the subcommittee approved limitations on BIA and IHS funding in 2024. I remind the subcommittee that its trust and treaty obligations exist irrespective of any self-imposed budgeting caps. For my tribe, there is no choice but to move to higher, safer ground. We purchased land adjacent to our reservation at 250 feet above sea level. The land is completely raw and undeveloped, meaning we must heavily invest to move our community there. This upland relocation project is currently estimated to cost up to $450 million. We have been tapping out our own reserves and doing everything we can to implement the early phases of this project, while still caring for our citizens simultaneously. Yet, the federal government is failing us. We are only able to manage our survival piece by piece, as we go from agency to agency and appeal to our congressional delegation to string resources together. This is unsustainable and inconsistent with the federal trust responsibility. I remind the subcommittee that the failure to dedicate adequate resources to these efforts is tantamount to being complicit in the disappearance of our lands, our people, and our way of life. Fortunately, I come here today to offer a potential solution. H.R. 7859, the Tribal Environmental Resiliency Resources Act, or TERRA Act. I thank you, Chairman Simpson and Representative Kilmer, for your vision and leadership on the TERRA Act, and I ask the other members of this subcommittee to support this bill as well. Modeled on the success of the PL 477 program, the TERRA Act would create a hub and interior for tribes to identify and access existing resources by integrating them into comprehensive plans tailored to their resiliency needs. We are finding that the problem is not that the resources do not exist, but more that they are siloed across the federal government with restrictive or conflicting timelines and requirements. The TERRA Act fills gaps and eliminates barriers, cutting through red tape to provide tribes with one place to go for accessing resources and deciding for themselves how to best serve their communities. The TERRA Act has widespread support from Indian country. I urge the subcommittee to support prompt passage of the bipartisan Terra Act. There is no time to waste. We also support increasing the IHS budget. We support full mandatory funding for all IHS accounts at $54 billion. The federal trust responsibility is obligatory and should be treated as such. We especially support mandatory funding for CSC and Section 105L leases, in line with the obligatory nature of these payments. If full mandatory appropriations cannot be achieved this year, we continue to support advance appropriations in the short term. Thank you for your time and attention. Our full recommendation is available in our written testimony. I invite all of you to come visit us at Shoalwater. We look forward to sharing with you our resilience as a sovereign nation. Mossy.
I will take you up on that. I have never been, Kim has never invited me to the Big Peninsula. He's just never invited me, and I don't know why. He's always saying, I want to go, and he says, no, you can't go. No, I'm just kidding. But I do want to get out. Surprisingly, having lived that close, I've never been to the Olympic Peninsula, really. I've been to Seattle, but I've never gone around on the peninsula and stuff. Yeah, I will do that. Esther?
Yes, hey everybody. My name is Esther Lucero. I'm Dene on my mom's side, Latina on my dad's side, and I am third generation of my family to live in an urban environment. It's really nice to see you again, Chairman Simpson, Ranking Member Pingree. My goodness, Congresswoman Betty McCollum, it's just really nice to see you. I haven't seen you for a couple of years, so wonderful to see you. Same with you, Congressman Kilmer. And I would like to welcome you, Congressman Edwards, to this committee. I love that you're on labor HHS. That's going to be significant, and I'll tell you why in just a moment. Nice to see you, Mr. Elsey. First I just want to start off, let's get out the appropriations out of the way. We are aligned with our 29 federally recognized tribes in the state of Washington, where they have swiftly and aggressively advocated to get the Indian Health Service to full funding. What that means for the urban Indian line item is we're advocating to get to $977.4 million. So that's very, very important that we move in that direction, and I'll tell you why. Last year, I came here and I spoke to the committee and I shared all of the incredible successes that we have had at the Seattle Indian Health Board. I was grateful for things like the funds that came through ARPA, infrastructure dollars, those types of things. And I expressed to you all what we have done with that money. I also was grateful for the fact that we'd secured a 2-year pilot for 100% FMAP funds. And I shared with you that we purchased a building where we're opening a 92-bed residential treatment program, right, to address the opioid crisis, which we're planning to open February 2025. And we talked about traditional Indian medicine last year a lot, and how we've actually developed a model where you can bill for it within our system. We've developed the mechanism to make that happen, where we have coding and everything you need to be successful. So why am I frustrated today? Because Chairman Simpson, you said we're not going to take steps backwards. I'm grateful that we didn't have cuts last year, and I'm disappointed to hear that we're not moving forward with 100% FMAP. And I'm going to tell you why that's important. Because we just learned from CMS that urban Indians are not going to be eligible, like tribes, to bill for traditional Indian medicine services. And they say it's because we don't have access to 100% FMAP. So here we are, moving out of a 2-year pilot where the Seattle Indian Health Board has been a leader in developing systems, and now we are not going to be eligible to receive that reimbursement. That is frustrating, because when we had 100% FMAP, we were able to build a residential treatment program to address a crisis that you all are talking about constantly, to address a crisis that is connected to our border issues, to address a crisis that's connected to missing and murdered Indigenous women and gender-based violence. We will increase the capacity for the state of Washington to address these issues by 64% with the opening of this residential program. And here I am today, going back to where we were 30 years ago. Secure 100% FMAP for urban Indian programs. Then you won't have to depend so much on Medicaid. Congresswoman McCollum, you mentioned earlier about Medicaid supplementing IHS. We either get to full funding or we make this billing revenue more accessible to us. Because I will tell you, I will do my part. We have been your greatest return on investment, right? We have businessmen at this table. And you know what that means. You invest a little bit of money and I gave you significant return. You asked us to improve our workforce development. Guess what? We went from one program to 29 different programs. We've graduated our first MSW practicum students who are now fully licensed. Every single one of our mental health providers is Native. We are making an impact. So what I'm saying is, you asked me to do something and I deliver. And I need you to not lose this momentum. Right? We secured advanced appropriations for 1 year. I'm hoping that we're moving to mandatory spending. Why can't we continue advanced appropriations? It worked for us. You're hearing from tribal partners the same exact thing, right? We start talking about suicidal ideation and suicide. The key to that is cultural, strengthening cultural identities. We've proven that. Our first data pool, for folks who access traditional Indian medicine in our services, there's a 28% reduction in suicidal ideation. 21% reduction in alcohol consumption, 5% reduction in depression. If you want to see changes in those outcomes and save our next generations, continue the investment. We will do our part. Yeah. I think that's what I have to say. Thank you for having me today.
Thank you. And let me tell you, Esther, I've seen no stronger advocate for this than you. So thanks for being here today. Ms. Fingry?
Yeah, thank you for your very strong, well, thank you both, and thank you for different reasons. Thank you for your strong advocacy. I will plead guilty to not completely understanding the technicalities of the FMAP, so I will educate myself overnight on that, and we can have a follow-up conversation, because I do appreciate the work that you're doing, and I am worried that we're dealing with tight budgets here, and we're making cuts no matter what. It was hard enough to get through 24, 25 is going to be even trickier. And just as you said, everything that we go backwards on is a real loss to healthcare centers like yours, but also tribes all over the country. So thank you. And thank you for filling us in on the challenges of your tribe. It's been a concern of mine for a long time. The communities that are on the edge of the water, I represent the state of Maine, so we know a lot about coastal erosion. We've had some extremely severe storms this winter and seen the level of damage that can happen in, a matter of 24 hours. Everything has changed. And so the fact that you guys are 2 feet away from your sea level maximum, that's really serious. So I hope we can continue to work with you more, and I appreciate your suggestions in that bill. I guess I'm not a co-sponsor, but I'll find out more about it. But I think in the long run, we really need to think about how do we get the levels of funding that you need, because $450 million to move one community, and we've got a lot of communities, multiples of them in Alaska, many I know in your state. Current estimates are something like, $5 billion just to move the communities that we already know have to be moved, and that is our obligation. So I look forward to working with you on that, and I yield back. Thank you.
Thank you. Mr. Elsey. Ms. McCollum.
I just want to thank you both for your testimony, and we just need a bigger allocation. We're hoping with our good friend from this committee, a good friend to Indian country, maybe we'll be able to do a little more than we have in the past. But I've learned not to make promises I can't keep, because you're dealing with hundreds of years of broken promises.
Yeah. Again, I'd just like to express my appreciation for you being here, particularly for the newer members of this committee. I think it's extremely valuable to hear from you. So thanks for making the commitment to be here.
Mr. Kilmer.
Thank you, Chairman. I want to start by formally inviting you to the 6th Congressional District of Washington. There we go. Actually, though, I also want to thank you, Chairman, for being a co-lead on the Terra Act. It's rare for someone from Montana to sign on to a bill that's focused on helping coastal tribes relocate.
If I was from Montana,
Idaho.
that would be important.
Yeah. Oh, sorry, Idaho. God. I knew that.
One of those.
Excuse me.
Maybe you can get Zinke on it.
Yeah, I should try to get Zinke on it. But it says a lot of his approach to these issues that, even though it doesn't impact his community. It impacts our country, and it impacts your tribe, and therefore he signed on to it. And that's a testament to his leadership. Chairman Swanson, can you just say a little bit more about like the sort of morass of when you're dealing with all of these different agencies, different sets of rules, different timelines, different matching requirements, what it has meant to you and your ability to execute relocation versus if we actually pass something like the Terra Act, you know, what it would mean in terms of your ability to get things done?
Yeah, so in the last year, we've received several different pieces of funding, $25 million through the Department of Transportation to put in a road to our new community, $6.2 million through HUD to build several townhouses, as well as $1.2 million through EDA to develop a master plan. HUD has given us 3 years to expend those funds. DOT has given us 8 years to expend those funds. From the time that HUD actually awarded us the money to expend and the time that we had it in our account to expend was about 3 weeks. We still have yet to be able to expend the DOT funding, and that's been 8 or 9 months now. And so these timelines don't really coincide well with each other. So we just awarded a contract to develop our master plan. We have 2 years to expend that. And it's really just been a piecemealing effort trying to cut through a lot of red tape, trying to jump through hoops. We received some funding, pass-through funding through IHS that wasn't able to touch HUD funding, and so we had to mitigate that. And so we're really hoping that Terra would be able to allow us to better piecemeal this funding and actually execute in a timely fashion without going through all these barriers.
I appreciate that, and would love to invite my colleagues to take a look at that bill. We'll make sure you all see copies of what it does. And this, to me, this is a good government bill. It's government efficiency, right? Let's not waste people's time and money by having different sets of rules and regulations. Let's try to have some clarity to it. Esther, thank you for your good words, and I think you're right. You're a terrific investment. You do a lot with a little. Can you tell, one, what do you, if we fund the urban Indian health at the requested level, what does it mean for the communities you serve, and what does it mean if we don't?
Well, I can tell you that for the 2-year pilot, it resulted in $11 million. And that is why we were able to purchase a building to be able to expand those services. Mm-hmm. So if you think about that investment going right back into communities, right, and what kind of dent that makes in to, our ask to get to full funding, that's significant. Yeah. The other thing is, because we're leaders in this effort, we are looking forward to sharing with our tribal partners, right, how you build it into the electronic health record system. I'm thinking about our movement, like we were the first urban Indian health program to become a federally qualified health center. And we were told that you couldn't build in traditional Indian medicine into the system. Well, we've proven that's wrong. We actually have 3 managed care organizations who have agreed to pay for it as a value-added benefit. We have one that's completely tested it in the system, and it works. It works. So if you want to reduce suicide in our communities, put a number on that.
Yeah.
Put a number on that.
Thank you. I yield back to the gentleman from Idaho.
Thank you, and thank you both for being here. And I will tell you, as has been said, last year was an ugly budget year. I understand why it was. We were overspending, we felt, and you look at the national debt and a few things like that, and we felt like we had to reduce spending. Now, we're never going to get rid of all the national debt by just cutting and cutting and cutting. But I suspect, and I told you last year, we're not going to go back. I will tell you it's going to be an uglier year this year. We're still not going to go back. Okay? Appreciate it. Thank you all for being here. Panel 23, Abigail Echohawk, Guy Copeman, Ed Johnston, and yeah. What's that?
TBD on where Guy is.
On who?
So now they're on suspension?
Okay, yeah. So no Guy. Abigail, no Guy. You related to Larry? Yes. All right, that's what I thought. We've met before, and yeah. Anyway, you're first.
How weird, you're so unrelated.
Thank you so much, Chairman Simpson and members of the committee, for having me. My name is Abigail Echohawk. I'm a citizen of the Pawnee Nation of Oklahoma, and I serve as the Executive Vice President of the Seattle Indian Health Board. You just heard from my boss, the incredible Esther Lucero, where I direct our all of our public health work, specifically our Tribal Epidemiology Center, the Urban Indian Health Institute, and I am here to speak to you about the work of our Tribal Epidemiology Center today. This week, or last week, May 5th, was National Remembrance Day on Missing and Murdered Indigenous Women and Girls. And it is one that our organization has been leading on. The Urban Indian Health Institute continues to be the national leader on research and data and interventions related to missing and murdered Indigenous women and girls. I spent that last week with young people in the state of Washington and across the country, where I realized as I sat in rooms with young women, Native women, that the number one thing that they are advocating for, as we think about folks who do high school projects, that are working in their colleges, who are researching and thinking about impact in their communities, is a majority of them are advocating on missing and murdered Indigenous women and girls and people. I sit with young people who the number one thing they're advocating for is to ensure that they don't get murdered. This is a reality that exists not only for the urban communities, but across our tribal communities. And so in 2018, the Urban Indian Health Institute released the very first data report on missing and murdered Indigenous women and girls, where we looked at the impact in 71 cities across the United States. That report was used and catalyzed to both ensure that Savannah's Act, which at the time in the iteration in which it had been written would not affect urban dwelling American Indians and Alaska Natives, it was used to ensure that urban Indians were included in that legislation. Within that legislation, the Department of Justice is to provide resources to not only the urban Indian people, but also urban law enforcement to ensure that they are appropriately addressing this crisis. And yet, last week, as I sat with advocates, I sat with family members, we wept more than we cried, we grieved more than we had seen any kind of justice. We recognize that the Department of Justice has completely failed to give those resources to urban Indian communities. So when we talk about the opiate crisis, homelessness, the high rates of suicidality, we are battling a crisis of trauma in Indian country. And until we address the root causes, we're going to sit here and continue to talk about how to combat the high rates of opiates and fentanyl. And yet, that is not what is happening. So urban Indian programs like the Seattle Indian Health Board and those across the nation, along with tribal communities, we are utilizing our IHS dollars, which are so essential, which is why we need advanced appropriations at the full funding levels of the Indian Health Service, because we are helping those family members who walk in our doors who have a loved one that's gone missing. I work with communities, for example, right now with a family where the mother, who has been in a long-term domestic violence relationship, had been impregnated, had 12 children before the age of 40, had suffered so much traumatic head injury that she was suffering from dementia. And yet our IHS dementia dollars are for folks who are elders, not for those who have been suffering traumatic brain injury as a result of the domestic violence that they are experiencing. And then that abuser, somebody not from our communities, was using her dementia as a way to not only keep her, because he would then say he would keep her children because she wouldn't be seen as cognitively fit to keep them. That is the crisis that we're talking about, and yet the Department of Justice has not stepped up. Recently in Washington, a family from the state of Alaska reached out because we had seen a murder of their loved one 5 months before, and yet the police department had never reached out to that family, had not assigned an investigator, and nor did they do so until the tribe reached out to the Urban Indian Health Institute, where we advocated for and were able to get that police department to appropriately invest and to work in a culturally competent way with that family. We're doing the work that the Department of Justice is supposed to be doing, and we will continue to do it, but I'm furious about it. And we continue to see folks walk in our doors who require, and we want to provide those traditional Indian medicine services that actually impact them, that actually show them that they are cared for and that our culture, we know, is what will lead us into healing. But until we can undo that underlying trauma, we're just going to be treating the symptoms. As a survivor of sexual violence myself, that happened on and off tribal lands. And yet we saw, in my instance, more than 20 years ago, where law enforcement refused to do anything because I was just an Indian girl, and that's actually what they told my dad. And then that person went on to abuse and rape more than 20 other people aside from myself. This maze of injustice that we all battle isn't something that is so far off that we just celebrate on May 5th and remember. May 5th for me was a time for action. And until we have full funding for the Indian Health Service, where our tribal epidemiology centers like the Urban Indian Health Institute finally have the resources and funding, we're going to be battling those symptoms. I don't want to keep sitting in rooms of young women who talk about what happened when they are going to get raped because they see it as an inevitability. Instead, I want to sit in rooms where we know that we are moving forward into healing, and I invite all of you to take that step forward with us, which means that we have to have full funding for the Indian healthcare system. We need to see a hearing related to missing and murdered Indigenous women and girls, and we have to ensure that urban Indians are included because we have been excluded in that up until this point. We need accountability, we need resources, and we need to ensure that our right as tribal nations for public safety, as is within the treaty and trust responsibility, is upheld. And until then, I'm going to keep showing up here angry, but I'm going to keep offering the resources and the ways for us to move forward. So thank you for having me here today. And again, I invite you, move forward with us in ensuring that this crisis doesn't continue.
Thank you, Abigail. Ed?
Yeah, thank you, Chairman. Boy, that subject affects me. I can't go into it, but that's close to my home, close to what I was exposed to. Thank you, Chairman Simpson, Ranking Member Pingree, Congressman Kilmer, honored members of the subcommittee. I come before you as a treaty Indian. I'd like to acknowledge our Congressman Kilmer from the 6th, that we've had a long relationship with the congressman. Also acknowledge our tribal leaders throughout Washington State that have come here and all over the country. Our connection with the Great Lakes and the Columbia River Intertribal Fish and Wildlife Commissions, our sister tribes, and those that have come before you and told our story as Indian people, that we spend our life's work for our people. And my name is Ed Johnstone. I am a Quinault tribal member. I am in leadership as the chair of the Northwest Indian Fish Commission. We're 20-member tribes in western Washington, created after United States versus Washington, the Bolt decision. We have extensive management responsibilities, very complex, that are coast-wide through the Pacific Fisheries Management Council, internationally with the U.S. Salmon Treaty, and then the relationships with the states of Washington, Oregon, Idaho, California, and Alaska. They're complex. Many of the stories that we face are stories you've heard today and yesterday about what climate has done to our natural world. Quinault's a reservation that needs to be moved up on the high ground, similar to Shoalwater Bay, similar to stories you may have heard out of Alaska. It's affected our ecosystems in the water and in the uplands, plants and animals, everything that's involved in our natural world. And so our written testimony, our written request, you'll see on the table out there, and we've advanced on behalf of the Northwest Indian Fish Commission, critically important to our responsibility as co-managers. And I also speak for my grandchildren. I speak for my grandchildren's grandchildren and for those yet to come. It's the 7 generations. I want them to have a place that has that cultural identity that is so much heavily impacted when you lose those kinds of activities that are your culture. And part of the demise of us as Indian people is because we've lost our identity. When we hear about those things that inflict our lives, and a healthy culture means we have healthy people. So there are, several programs, such as the $66 million for BIA rights protection. That's foundationally is the base funding for our tribes from the beginning. $1.109 million for salmon steelhead habitat inventory and assessment program that many of you are aware of, that we worked on so hard to get it in position to be something that has the ability to us to look at those salmon recovery plans that were adopted and actually work through the planning process that characterizes what those all of those natal streams from every one of our 20-member tribes in order to rebuild those stocks. Very, very critical. We want to maintain that and go forward. Stable is good. Going forward is better. $15 million for BIA fish, wildlife, and parks, and $2 million for Western Washington Treaty Tribes wildlife management. We're working on additional legislation. We haven't gotten there yet. Working with one that maybe is out there and one that we've worked on for a long time. And $57 million for EPA's geographic programs. And with that, I appreciate your time. We have been supported very well here through our rich history of the leadership of the 6th and our tribes. Thank you.
Thank you, Ed. I appreciate the work that you guys do trying to save the resources of the Pacific Northwest, particularly salmon. As you know, I'm very interested in that, and the ones that come to Idaho or don't come to Idaho anymore that should. Abigail?
Mr. Chair, I'm happy to tell you that my daughter is a Nez Perce tribal member.
All right, good. Abigail, I don't think you could be any more upset about what's happening with murdered and missing indigenous women than I am. We look back at 9/11, and we can all picture on TVs watching the towers come down and travesty that was. We lost 3,000 people, but it was all at once. So it was very dramatic, obviously, and it's burned into all of our memories. We lose twice that many women, tribal women, across this country every single year. 6,000. I had heard about it kind of in the ether, but about a year ago I was watching the Idaho Reports on, the Idaho Reports program. I was watching it on TV, and they had a woman on from the Nez Perce tribe who was active in addressing this issue and stuff, and I sat and listened to her for a half hour, and I thought, why doesn't the rest of the country know this? Because I will guarantee you that if the rest of the American people that are good people knew the facts about this, there would be outrage. And yet very few people know about it. Very few people know how many murdered and missing indigenous women there are. You can bet there's going to be a hearing on it. And we're going to call in the Department of Justice. We're going to call in people that know about it and find out what's going on and why is it going on and why are we not addressing it. And I suspect a lot of that is going to be, not all of it, but some of it's going to be inadequate law enforcement with the tribes and that we haven't funded and a few things like that. But it's going to be a big issue, and we need to highlight it so that the American people know about it. But why has the news media reported on this?
So our original research in 2018, we actually took a look at media and found that media not only was less likely to report the murders of Native women, but if they did, they would do things like show their bodies, or instead of showing a picture of them with their families, they'd show a mugshot, for example. So it also creates stigma and prejudice. So we have been working actively, and the Native American Journalists Association has been doing an incredible job on working with media, and we've seen some significant changes, but more needs to be done. When it comes to the non-actions of the Department of Justice, specifically for the urban Indian population, is that one of the things that's supposed to be done under the Not Invisible Act is focused on the data. So we do know that 6,000, I actually think it's probably double, if not quadruple. It's just the data doesn't exist. And so under the Not Invisible Act, Department of Justice is supposed to be working towards capturing that data, and they have not worked with the urban law enforcement. 78% of Native people live off reservation and village lands in urban areas, and it makes us invisible. So the Not Invisible Act, I love the name, but we're completely still invisible. So the Urban Indian Health Institute is the only organization that I'm aware of in the nation that currently works with law enforcement and has been redoing and working with them on in fixing their data systems. But why are we doing the work of the Department of Justice under the $2 million that I receive from the Indian Health Service as a tribal epidemiology center? And the lack of accountability and the lack of them investing in and ensuring that those living off reservation actually receive the benefits of Savannah's Act and the Not Invisible Act. I am excited to see the recommendations that came out from the Not Invisible Commission, and some of the answers from the Department of Interior are definitely lacking, but we need to see what happens for those of us who are living off reservation. I am a tribal member that goes back and forth to both my homelands in Alaska and in Oklahoma, and I deserve safety regardless of where I am.
Absolutely. Thank you. Ms. Pingree.
Yep. And thank you very much. Thank you both for your passion on the issue and the work that you've been doing for so long, but also being here today and providing us with so many important facts. And I really appreciate the chair's decision to hold the hearing. I think it'll be very impactful, and I hope that we will see some level of change going forward from that. So thank you for the work that you've been doing. And Chair Johnstone, thank you. I appreciate and feel sympathetic towards the reaction that you had hearing about this, because everyone has a family story, and I
didn't know it was going to happen.
Yeah, it's not easy when those moments happen. But also thank you for the work you've been doing with natural resources and salmon, and for the challenges that your community has in relocating. I hope we're really able to put more focus on that going into the future, and how we support those tribes that have to move and have natural resource issues to deal with. So thank you for being here and talking to
Appreciate
us about that.
I do live in Tohola, although I'm with the Northwest Indian Fish Commission on this part of it, but I worked extensively as 20 years on the school board to get our children out of the tsunami and flood zone. And now we are, through the state of Washington, their resources, #1 on their list to move us, our little ones, through high school up above that elevation level. So appreciate that.
That's great. Thanks. I yield back.
Josie.
Thank you both for being here. Abigail, thank you for your passionate testimony today. We can spend all day talking about this, about the data, but I'd love to get with you, get my office with you, so I can learn more about this, and so hopefully we can put an end to this epidemic at some point. And at least, as you said, Mr. Chairman, it only recently with popular media, I think probably with arguably Yellowstone, did anybody know that this was kind of an issue, at least in the population writ large. And when we talk about suicide and hopelessness, all those things go together. So if you feel isolated and hopeless, that there's no law enforcement, that nobody cares about your people, nobody cares about your women, then it leads to desperation and drug abuse and fentanyl use until you die, or suicide. So they're all linked together. They're all linked. So I need to learn more, and I want to work with you to do that. And anybody, and Esther, your passionate testimony as well. You're a force of nature. So be out there spreading that word, because especially I'm going to be here for a long time on this committee, working with the chairman and everybody here. So this is not a left or right, Republican or Democrat. This is an American issue, and so we care.
Thank you so much, and we look forward to working with your office. I think about when I first walked into the doors of the Seattle Indian Health Board, I was a young person who was pregnant who had been experiencing suicidality since the age of 9 years old. And my very first counselor, not at Seattle Indian Health Board, but elsewhere, I made her cry. I comforted her at the end of it. And that is one thing that we have found in our research is that there are not enough behavioral health specialists who understand the unique circumstances of a father being told, like me, we're not going to investigate your daughter's rape because she's just an Indian girl. What happens to that father and what happens to that daughter? And I knew when I walked in the doors of the Seattle Indian Health Board, like all of our urban Indian health programs, that I was supported, loved, and I had culturally based services, even though they were limited around me. And so that is what we are doing at the Indian Health Service for all of us funded in the ITU system of care. How do we ensure we get the appropriate resources? And when it comes to law enforcement, I get to work with law enforcement across the country. They want to know. We have so many good law enforcement who are not getting the resources to understand how to address this crisis, and that is the failure of the Department of Justice.
Thank you. And I just want to add to it, I want to make it clear that I wasn't trying to refer to anything about Yellowstone or anything like. I don't have any tribes in my district, but I'm proud to be on this committee and learn about these problems because the human trafficking issue in this country is a crisis. It is an epidemic. And I just need to learn more, and so I can't wait to work with you.
Look forward to it.
Ms. McCall.
Thank you. Back in the late 90s, there were stories of women missing in Duluth, indigenous women. Nobody really understood. Well, maybe they just left. It was a bad situation at home. And when I got on this committee and learned that 84% of my Native American sisters would experience sexual violence, that was mind-blowing. And then when we first started visiting, and you might remember this, Mr. Chair, with Mr. Cole, some of the tribes, we were talking about the backlog of rape kits, how there weren't rape kits available. No city, no county, no state in this country would allow that to happen. So then we were going to fix that. And then finally, because of hard work of tribal leaders, tribal women, we started hearing about what we needed to do nationally. So New Mexico and Washington State are two of the states that have the highest numbers. My state, Minnesota, has a pretty high number. But we're not sure what that number is. Is it 27? Is it 54 between 2012 and 2020? So we don't even know in 8 or 10 years what the real number is. So we took action, but the reason why we took action in Minnesota is the Lieutenant Governor, member of White Earth, and having 3 members, tribally enrolled women, in our legislature who had allies who just didn't know how to lead on it. So we were the first state in 2021 to put together a state task force on it. We're trying to get it resourced, but with all the stories that we heard about counties and cities and the feds not working together on what happens on reservations, and there's so much more work to be done. So thank you for bringing it up. And when you meet families and when you meet victims, it changes your life. It makes you mad, but then it makes you determined. And I know you said you were mad, but I could hear the determination. Thank you for your testimony.
Thank you so much, and we continue to be so grateful for the work of Lieutenant Governor Peggy Flanagan and the team in Minnesota who have really set up an example of what it could look like for a state to take action. And the data issues continue to be a problem there, which we continue to consult with them on. And my organization, the Urban Indian Health Institute, has funded both tribal communities and urban Indian communities in Minnesota to specifically take action on gathering data appropriately. So again, we are working to do the work of the Department of Justice that they're supposed to do under the Not Invisible Act. And like you said, I'm angry, and angry can be a very good emotion when utilized appropriately. We have to be effective, and that is what is lacking in the federal response right now.
So we're raising awareness with license plates now, and the money's going to go back into helping address this crisis. If you would, because I think you'll be more eloquent at it than I would explain. We have Amber Alerts now too in Minnesota. If you would explain the red hand on the mouth.
So actually that brings up, and this is in my testimony, the FCC has put forward a proposal to establish what they're calling an endangered persons alert system based on what we did in Washington State, which is what we call the red alert. It was then used as an example now in the state of California, the feather alert. So it's similar to the amber alert or silver alert. So when an indigenous person goes missing, the screens that we have, it pops up. And we've actually seen about 75% success rate in utilizing those. So the red hand across the face was started by a young person who was running on behalf of indigenous peoples. She was in California. And it represents both the silencing of our people. And for many different tribes, it's different. So for Pawnees, red is the color, our first color, it's the color of prayer. So I see prayer in it, but I also see the blood of those who have been silenced. And so the red hand allows us to, again, use symbolism, which we do see in the media today and has really helped with raising awareness of not only invisibility, but also the strength of our people. Because the one thing we can't ever leave behind is the fact that despite all of this, we are still here, we are still vibrant, we are still building strong, beautiful tribal communities, urban and rural, and we will continue to do so. However, we shouldn't have to do it under such levels of injustice. And that red hand is one of the ways for us to raise that awareness and push it forward. And it's also an opportunity for all of you to show that you stand with us. I'd love to walk into all of your offices and to see one of those red hands, which we have in bumper sticker. I can get it for you. I'd love to see them in your offices as a way and as a recognition that you stand with us.
Mr. Edwards.
Thank you, Mr. Chair. Again, I'd like to express my appreciation to Mr. Johnstone and you, Ms. Echo Hawk, to tag on to many of the things that I've already said. I think you're going to find a great deal of folks up here care. It's unfortunate that you're dealing with issues that are somewhat hidden to the rest of us, and so it's important that you're here to help raise awareness and to continue to be here to help raise awareness. And I ask you to not allow us to let your issues get lost in the noise, of which there's so much up here. So thank you for being here. And please make sure my office gets a red hand too. This guy over here will take it back to the office for you. Thank you.
Mr. Kilmer.
Thank you, Chairman. And thank you both for being with us. Chairman Johnstone, thank you for your words. I'm conscious of the fact that hopefully a year from now when you come to testify, the statue of your predecessor, Billy Frank Jr., will be in Statuary Hall, which is a really big deal. And Chairman, I know you knew Chairman Frank, and I know that Ed would want to invite you out to Tahola too, which is just a beautiful part of the world, but also incredibly vulnerable just to flooding and some real challenges being on the coast. Ed, one of the things I was hoping you would just speak to briefly as we talk about the importance of salmon recovery and protecting treaty rights is that Puget Sound Geographic Program. Would you just say a few words about why that program matters?
Thank you, Congressman. It's critically important to us. I mean, the geographic program and the salmon recovery in Puget Sound is that effort that kind of coalesces everything and gives funding to tribes to do the work that's necessary on the habitat. And so much of what we do is threaded in. It's all like threaded our spider web together, and that's a critical piece. And we've been continuing to grow that program, and we've received extensive funds that supplemented like BIL and IRA, but what we're after, that we're those were, we don't want them to supplant, I guess. What we're after is continued support of that geographic program. So many critical areas of the work that are done through that geographic program. Yeah, it's really critical for us.
Yeah, Abigail, thank you for being here and for your good words. I can't remember if it was the last time I met with you or the time before you talked about access to behavioral health information and the fact that tribes and tribal epidemiology centers don't have access to their own to data. And since you're with us, I was hoping you might just say a word or two about how having access to tribe-specific behavioral health data might actually help in terms of the provision of care, improving mental health and substance services.
Yeah, this is really something that I think rose to national prominence, where people actually became aware for the very first time, although we've always been aware that tribes and tribal epidemiology centers don't have access to the data, despite it being one of the, where tribal public health authorities under the Affordable Health Care Act, we are supposed to have access to data, and we don't. And during COVID-19, we couldn't get access to simple things like infection rates within the communities. And out of that kind of birthed the further conversations related to behavioral health and other types of data. If we don't have access to the information, how do we make good data-driven decisions and get information to policymakers for the appropriate programs and response? The access to that information is also, again, under federal law, and tribes should have access to their information. They need to ensure they have the information they need on their tribal members in order to, again, understand the impacts of the ongoing trauma, the need for where we need to invest programs, and where we have gaps and opportunities. And so access to that data is one of the things that the tribes and tribal epidemiology centers have been fighting for. There was a Government Office of Accountability report that came out that recognized that HHS was severely lacking in this. We've seen some response. It has been minimal, and we definitely need to see more. I would definitely advise your offices to take a look at both the report and the response that came from HHS, because the tribal communities and the tribal epidemiology centers is we're asking for more. We need access to that information so that we can come to you with what is needed within our communities. And also, we know all of our tribes, as has been illustrated today, we're doing incredible work in the urban and tribal settings, and we want to be able to tell you about the successes. But when we don't have the data, we can't tell you that either.
Thank you. I yield back, Chairman. Thank you.
Thank you. And again, thank you both for being here today and for your testimony. It's very impactful on us.
Thank you, Mr. Chairman. I heard Congressman Kilmer, I think in the previous panel, with an invite to the Pacific Northwest, and we'd be happy to host and show you where those critical dollars that flow throughout our funding requests are applied, and we can get you well informed of what that means and where we're going and our successes and what our challenges are. So with that, thank you very much.
Thank you.
Thank you so much.
You bet. Thank you. And our 24th panel, which is the last panel that we have scheduled. Nicholas Lewis, Cody Salter. Don't know if that's close. Dissatel? Okay. Corrine Sams and Michael Rondeau. Do you care which order you go in? If not, I've got Nicholas first.
Chairman Simpson, Ranking Member Pingree, and members of the subcommittee, I'd like to thank you for holding the American Indian Alaska Native public witness hearing and for inviting the Northwest Portland Area Indian Health Board to testify on the Indian Health Service budget. I thank this committee for its continued support for our Indian Health Service funding that we've received. My name is Nicholas Lewis. I'm a member of the Lummi Nation in Washington State, where I have the honor to serve my people as a council member on the Lummi Indian Business Council. I also serve as the chairman of the Northwest Portland Area Indian Health Board. And I'd like to say that today in this testimony is an opportunity for this subcommittee to take action that can save lives. Overdoses have become too common in our tribal communities. We've seen parents have to bury their children, children have to bury their parents. We have seen in our tribal communities children removed due to exposure in their homes at higher rates when compared to other communities. These losses are creating more trauma in our families and in our communities. With your commitment to significant increases in funding to the fiscal year 2025 budget to address the fentanyl crisis, this committee will be honoring the loss of our loved ones and helping us all heal. In August 2023, the Northwest Portland Area Indian Health Board helped lead and spearhead a National Tribal Opiate Summit. That summit brought together over 1,000 tribal leaders, frontline workers, and community members impacted by opiates. Families shared their heartbreaking stories of loss. Former users shared their stories of resilience and healing. Frontline workers also spoke to the support that they need. Tribal leaders also voiced their need for effective action. I wanted to bring some of those requests to the subcommittee, such as increased substance use and mental health funding to help us address the underlying trauma in our communities. Unaddressed trauma will continue to pass down from generation to generation until somebody is ready to feel it. Many in our communities are sadly not ready to feel it. They avoid this pain through continued substance use, and the cycle continues. The American Indian and Alaska Natives have the highest rate of suicide of any minority group within the U.S., as well as high rates of substance use disorder in both illicit drugs and alcohol use. We must stop this cycle and provide opportunities for our community to heal. With increased alcohol and substance use funding, there can be more focus on prevention. It is critical for the future of our health in our communities, from our children to our elders, that prevention is funded. In the Northwest, we have 5 Washington tribes that have committed to implementing the Icelandic prevention model, which is a model that is based on long-term systemic change that has been proven to heal the community. This model contributes towards revitalizing our communities to being healthy like they once were. The Portland area tribes have long recognized that culture and traditional activities, including language, are good prevention. One of our young emerging leaders from the Northwest, who is here with me today, has said that being on the water and in the canoe with her family throughout her youth kept her focused on her culture and in her community, but more importantly, out of trouble. This is the type of prevention activity that the Icelandic prevention model supports, and that with increased Indian Health Service funding could also support. In the fiscal year 2025 budget, we request that this subcommittee fund the alcohol and substance use abuse account at $4.86 billion and mental health at $4.46 billion. One of the biggest barriers to treating our tribal members in our community is the lack of facilities. For the fiscal year 2025, the Portland area tribes request the subcommittee allocate $5 billion for treatment, facility construction, dual diagnosis facilities, and medically supervised withdrawal detoxification for adults and our youth. Our final request as to behavioral health is a repeated request, and that we again ask that all behavioral health grant funding opportunities, including opiate funding, have the option for tribes to receive funding through their compacts and contracts. Lastly, we'd like to ask the subcommittee to ensure that appropriations for the Indian Health Service subaccounts are never rescinded. This is a particular concern for our tribes in the Northwest related to unobligated purchase and referred care funding. This impacts our funding to support our first regional specialty referral center, and we request that this subcommittee do everything it possibly can to ensure that this funding is not rescinded to the balance of the debt of the federal government. Thank you to the committee for allowing me a moment to testify, and I invite you to visit us more and learn about the utilization of how we do this funding and how we serve our communities. And I look forward to working with this subcommittee on that work going forward.
Thank you, Nicholas. Cody.
Thank you, Chair Simpson, members of the committee. I'm Cody Dizitel, President of the Intertribal Timber Council and Executive Director for the Colville Tribe. On behalf of the ITC and its 60-member tribes, we thank you for the opportunity to provide testimony today on the subcommittee's FY 2025 spending bill. I would like to start by sharing some statistics from the recently completed IFMAT report. Every 10 years, an independent team of scientists review the management of tribal forests and present their report to Congress as mandated by statute. IFMAT 4 noted that harvest levels have dropped from 730 million board feet in 1991 to 342 million board feet in 2019, which was the lowest harvest level since the Depression era. Over that same time, tribal forest acres have increased from 15.6 million acres to 19.3 million acres. The 2023 IFMAT report and those that preceded it documents the significant and persistent inequity of federal funding for Indian forest management versus other federal forests. Based on the IFMAT findings, the U.S. Forest Service is funded at almost 3.5 times per acre what the BIA receives for forestry and fire funding. The comparison to Western Oregon BLM lands is worse, with BLM receiving forest management funding that is 14 times more per acre than BIA receives for tribes. Also, much of the BIA funding is competitive, which makes it difficult with funding uncertainty to build the capacity needed within tribal programs to treat landscapes at the scale needed. The IFMAT report documented the BIA forestry funding in real terms has declined by almost 36% over the last 30 years when considering inflation and the increased trust acres under BIA management. The result of this inequity is catastrophic to Indian communities. The IFMAT report found limited funding for BIA for forest management resulted in $400 million in foregone timber revenue to tribes between 2010 and 2019. Which could have provided essential social, educational, and public safety services to some of the most vulnerable Americans. In addition, uncharacteristic wildfires have caused additional unquantified losses to timber, wildlife, aquatic, and cultural resources. The Cabo tribe, for example, has lost over 1 billion board feet of timber since 2015, with a current market value of approximately $500 million. The IFMAT report found that to reach budget parity between BIA, the National Forest System, and BLM forests, an additional $96 million per year would be needed for BIA forestry and $42 million in additional wildfire funding. Unfortunately, the now enacted 2024 Consolidated Appropriations Act reduced BIA's trust and natural resource management appropriations by nearly $11 million from the FY23 enacted level. That reduction includes a $3.1 million cut to BIA forestry, bringing funding down to $62 million annually. For comparison, the BLM was appropriated $142 million for the Wild Horse and Burro program in 2024, more than twice what all Indian country gets for forest management. So our recommendations for the FY 2025 budget: for BIA forestry, in light of the findings of the IFMAT report, the ITC requests that this committee make a historic decision to fund Indian trust forests on parity with the Forest Service and BLM funding levels. This would require an increase in base BIA forestry appropriations by $96 million for a total of approximately $162 million. For the DOI Office of Wildland Fire Management, the ITC requests that preparedness be funded at the IFMAT recommended levels as well, increasing current funding levels by $42 million to bring parity with other federal forest management agencies. The ITC would also request that the Department of Interior fuels and burned area rehab budgets be returned to fiscal year 2023 levels, an increase of $33 million for fuels and $10 million for fire rehab from 2024. Another issue that remains unresolved is the inclusion of tribal firefighters in the wildland firefighter compensation benefits, currently available for federal employees. I urge this committee to work with the administration to identify and fund a mechanism that respects the role of tribal firefighters performing federal firefighting functions under 638 contracts. In closing, I want to thank Congress for the expanded management authorities to promote tribal co-stewardship and management on adjacent federal lands. However, without adequate funding and staffing to support tribal programs, it will be challenging for tribes to build and maintain the capacity needed to both take advantage of those co-stewardship opportunities and accomplish their management goals on tribal land. Thank you, and I stand ready to answer any questions you might have.
Thank you, Cody. Green?
Tots Kalawit, good afternoon. Chair Simpson and members of the subcommittee. I am honored to appear before you today as a leader of the Columbia River Treaty Tribes. My name is Corinne Sands, and I have the privilege of serving as the chair of the Columbia River Intertribal Fish Commission. I also am an elected member of the Confederated Tribes of the Umatilla Indian Reservation Board of Trustees. Our tribes have called the Columbia River Basin our home since time immemorial. The salmon, lamprey, and other first foods found there are sacred to us. They are the lifeblood of our culture and way of life. For thousands of years, we have been the stewards of these fish populations, and our habitats depend on them. However, the development of the American West significantly impacted these fish and altered the ecosystem they depend on. Today, the once abundant runs are a shadow of their former numbers. 12 salmon and steelhead populations are listed as endangered. Pacific lamprey and other cultural important fish have declined 95%. This trajectory threatens our culture, heritage, and identity. This is why the rights, protection, and habitat restoration work we carry out is so vital. With this committee's support, we can continue our efforts to halt this decline and breathe new life into fish runs that are central to our tribal cultures, the region's economy, and the ecosystems of the Pacific Northwest. I come before you with a suite of strategic funding requests under BIA's rights protection implementation programs. For over 4 decades, federal investments through the programs have helped implement effective tribal self-regulated and co-management systems, provide cultural and conservative and conservation enforcement, and assist in our tribal fisheries and habitat restoration efforts. And we thank Congress for the long-term investment in protecting our treaty reserved rights and the commitment in restoring and protecting our salmon. I would like to highlight several current and developing needs required in order to fulfill responsibilities to our tribes and resources. They fall into 3 categories: fisheries and resource co-management support, infrastructure and safety needs of tribal fisheries, and preparing for the future. Fisheries co-management responsibilities lie at the core of our work. We participate in salmon and land use actions and conduct scientific monitoring, research, and policy development that guide on-the-ground actions. This effort is essential to the meaningful and effective tribal co-management and also provides critical data that are needed for our federal and state partners. Our role and responsibilities have grown over the years, like the Fish Basin Fish Accords, yet capacity funding through the Columbia River Fisheries Management Distribution has not kept the pace. We support the President's budget request of the $6.292 million for this item. We also participate in the Pacific Salmon Treaty and the Columbia River Treaty process between the United States and Canada because our co-management responsibilities do not stop at the border. The Pacific Salmon Treaty allocates West Coast stocks to assure equitable sharing between all parties, and the Columbia River Treaty deals with the transboundary issues of water and river management between the 2 nations. States receive funding to participate in the Pacific Salmon Treaty through the State Department, while tribes participate through the RPI funding. In conjunction with the Western Washington Treaty Tribes, we support the President's request for the $7.82 million. We also request support for our leadership roles in both Columbia River Treaty, Modernized Talks, and Pacific Salmon Treaty. We would like to get moving on infrastructure needs and safety for our tribal fishers. These are specifically the 31 fishing access sites along the Columbia River. These are federally owned, and these sites have a higher anticipated use, leading to more maintenance issues, housing scarcity, and law enforcement needs. These needs are funded through RPI distribution, and we support the President's request of the $1.72 million operations and maintenance and the $2.5 million for the PL 116-99 construction and the $1.166 million law enforcement. Last, we'd like to think to the future. We cannot ignore the growing impact of climate change. Our tribes are place-based people with deep connections to our geography and ecosystems. With the changing climate change, it will impact our culture and way of life. Funding is urgently needed. The BIA budget includes a climate resiliency sub-activity. We support President Biden's request of the $48.837 million to fund this very important work for Indian country. Ending on our note of positivity, we want to emphasize the importance to carry out our youth programs and support the Biden's request of the $555,000 for our youth initiative programs. We'd like to inspire our youth and our next generation to continue this work. This is our ancestral obligation. This is serious work, and the partnership between the tribes and the federal government benefits us both. And I hope working together can lead us to leave Mother Earth in a better place for all of our children. Thank you for your time and consideration.
Thank you, Free. Michael?
Thank you, Mr. Chairman. Thank you, Chairman Simpson and the committee. I appreciate the opportunity to speak before you. My name is Michael Rondo, and I'm the chief executive for my tribe, the Cow Creek Band of Umpqua Tribe of Indians. We are a tribe of almost 2,000 tribal members. Most of our people live in southern Oregon in our ancestral territory. The tribe provides many services to our tribal members, including health care, housing, education, job assistance and vocational training, behavioral health care, as well as a food pantry for those in need. The tribe also provides health care and housing to non-tribal members in our community through our health clinics and rental housing. Our Land and Natural Resource Department oversee the forest lands and regulate the practices of our traditional lifeways of hunting, fishing, and gathering traditional food sources. We are extremely proud of the hard work that we have done to build a strong tribal government that strives every day to provide vital services to our tribal members. I'm here to discuss three of our most important priorities, which are land into trust, law enforcement funding, and wildland fire suppression. I'll probably just get to the first one because of time limits, but I understand that you heard from Chairman Atterbury yesterday from the Karuk tribe, and I'm echoing his testimony on lands into trust. The Biden administration's policies of taking land into trust on behalf of the tribe is on the surface an admirable policy goal and one that Cow Creek generally supports. However, we strongly believe that no dollars should be appropriated to take lands into trust for off-reservation casinos, where a tribe has absolutely no and academically recognized ancestral or cultural tie to the land they seek to have taken into trust. Allowing tribes to disrupt historical kinship relationships with our homelands by doing an end around of the law is not something that the Department of Interior should be allowed to spend taxpayer dollars on. There's one such off-reservation gaming project in southern Oregon under consideration by the Interior Department, which would cause catastrophic harm to at least 5 other tribes in the area in both Oregon and California. And in a 2-state politically conservative rural area within 2 politically liberal states, this issue has managed to bring together an unusual, broad, bipartisan coalition of liberal and conservative voices in opposition. This off-reservation casino has been opposed by 28 current and former members of Congress, including the congressman from Southern Oregon and Northern California, and all 4 of our senators representing Oregon and California. Additionally, this casino has been opposed by the current governor of Oregon and 4 governors prior, and the project was rightfully and legally rejected by the last administration. The casino's proponents have presented their efforts as a zero-sum game, only hurting our members in order to hurt theirs. But the facts show a very different story. Their proposed casino has been opposed by over 60 tribes, and my tribe, the Cow Creek, is among the 5 tribes who will be directly harmed, causing a profound disruption in our ability to provide programs and services to our members if this project is allowed to proceed. 5 tribes members would face cuts in health care, housing, education, and employment assistance programs. Our people would suffer, and these reductions in tribal services would put further drain on public services offered by the states and counties. For some inarticulate reason, the administration has revived this project despite the fact that the proponent tribe has absolutely no ancestral ties or cultural ties to the area. That tribe is seeking to develop a second casino nearly 170 miles from its reservation in other tribal people's homelands. Further, the administration has been allowing this project to proceed despite the fact that, unlike virtually all other casino proposals that operate under a two-part determination, here the proponents are being allowed to proceed under a novel path that completely cuts the governor's say out of the process. We ask the committee appropriate no funds for any off-reservation trust application for gaming where a tribe has no ancestral or cultural ties to the land being considered for the trust status, and where the governor of that state they represent will be wholly cut out of the process. Thank you again for allowing me to testify before you.
Thank you, Michael, and thank you all for being here today and for your testimony. Mr. Kilmer?
Thank you, Chairman, and thanks all for being with us. Chair Sams, I was hoping you could just say a few more words about the BIA rights protection funding and what it means when adequate funding is provided and what it means when it's not.
So, when the hydro systems went in, it flooded out many of our villages where our people lived and had access to fishing grounds. And since then, we've revitalized it with the inland treaty fishing access sites. And, it's imperative that our fishers have a healthy and clean place to live and to harvest fish and to be able to take care of those fish. And so it's essential to our ceremonial fishing needs. So we have fish on our tables for the 4-member tribes.
Thank you. Thanks each of you for coming. Appreciate you.
Trevor?
Thank you, Mr. Chair. Again, thanks to all of you for being here. Ms. Sams, just a quick follow-up question. You had mentioned a fund proposed by President Biden of $48.5 million. I believe that was for, I'm going to call it climate litigation. You used another term. Can you remind me the name of that fund?
That is, let me look, sorry. Trying to find it. I'm sorry.
That's okay. I'll follow up another time. I just want to express my appreciation to each of you.
It's the Tribal Climate Resiliency Sub-Activity, and it was supported President Biden's request of $48.837 million.
Okay, 48.8. What? I'm assuming that's a fund that you would make application for grants. Is that right?
I believe so.
What types of projects could we expect to see were you to be awarded grants out of that fund?
I would assume water quality, potentially more studies on hydro systems, and I'm not sure what else, but
okay.
Any information that you, for follow-up, we can get to your office.
All right. I appreciate all of you being here. It's been very informative for me. I was explaining to a group earlier, I do have one tribe in my district, but the issues they face are materially different than any I've heard here today. In fact, they're in pretty good shape. Don't tell them that I said that, compared to so many others out there. So thank you for being here.
Let me just ask one question, Michael. You mentioned during your testimony that the building of this casino would harm 5 tribes financially, I guess?
Yes.
How exactly would that work?
Well, we're located in a very rural area in southern Oregon, northern California. I can speak for my tribe based on the information that was submitted in the NEPA process with the other tribe. Our tribe would be impacted by 24% of our revenues. We use our revenues because we have no tax base.
Now, how would that impact your revenue if someone else built a casino somewhere? I mean, it's
because of market share. And
do you have a casino now?
Yes.
So, okay, I understand what you're saying now then.
And this other tribe has a casino as well in an urban area.
Right.
And this would be a second casino located in an area that would affect 5 other tribes in a very negative way.
I understand what you're saying now. I was wondering how, I thought maybe it meant that it was going to reduce funding from BIA or something like that, but that's
No.
not the case. It's
No.
that you have a casino and it's competition and stuff, and
Yeah.
they would be building a casino where they are traditionally have never been.
Yes.
So, okay, I
Yeah,
understand.
there's two processes for which to
Right.
apply for trust. One of them is restored lands, which means that you've had some historical tie to it.
Right.
And the other is a two-part determination that allows the governor to make a decision.
Right.
And in this case, this is a restored lands claim for which they have no entitlement to.
Yeah. Thank you all for being here. It might sound like it might seem to you like that it's not very important to us, but I will tell you it is very important to us. That you come, even the 5 minutes we give you to talk and stuff like that and answer a few questions that we have, it informs us and gets us thinking. Because some of the things that we've discussed over the next 2 days, I'll go home tonight and go, oh my God, how are we going to solve that? And but I mean, and that's what needs to be done.
That's true.
And we look forward to working with you as we put together this budget. And as I told someone earlier, we ain't going back. We're going to fix this. Okay? Thank you all. This concludes our 2 days of hearings on American Indian and Alaska Native testimony on issues. So I thank you all for taking the time to join us today. We sincerely appreciate all of you coming to testify before our subcommittee. And with that, the committee stands adjourned.